Okay, good evening, everybody. Once again, welcome back to another episode of Mondays with Maishi. This is Moshe Norman here in Lakewood, New Jersey, joined tonight with Dr. Zindel Segal of Toronto, Ontario, in Canada. So thank you very much for joining us tonight. Tonight's topic is the mindfulness based cognitive therapy. I just got confused because Dr. Segal is the author of the book, The Mindful Way Through Depression. And we're going to get to hear a little bit tonight, or perhaps a lot tonight, about mindfulness and depression. And let's compare some of the studies of cognitive therapy and depression, other forms of therapies and depression, versus just using something as simple and profound as mindfulness. So Dr. Segal, thank you very much for joining us tonight and agreeing to come on and giving of your time for the mental health community. We really appreciate it.
Thank you. It's a pleasure to be here with you tonight.
Okay. Well, you're very, clearly very esteemed guest and founder of something very, very powerful. Can you tell us a little bit about your entry into this field and what got you interested in mindfulness, what got you interested in cognitive therapy and the synthesis of mindfulness and cognitive therapy? Tell us a little bit about who you are.
Sure. So I'm a professor in the Department of Psychological Clinical Science at the University of Toronto in Scarborough. I've been here about 10 years, but before that I worked at the Center for Addiction and Mental Health for about 25 years. And unlike a lot of people who are very smitten, let's say, with mindfulness, I didn't start embracing mindfulness from the meditation world. I actually started to understand its relevance from the cognitive therapy world. So when I worked at the Center for Addiction and Mental Health, I ran a cognitive therapy unit that provided cognitive therapy for people with anxiety, depressive disorders. And the understanding that I had of cognitive therapy was that when it works really well, it helps people to step back, develop some psychological distance from their thinking. So they have a different relationship to their thoughts. They're not as bound by the content of their thoughts. They're able to see their thoughts as ideas, interpretations, things that pop into their mind automatically, hence the term automatic thoughts. But with time, they develop this ability to step back. And I felt that people who are able to do that in our clinic were also people who benefited tremendously from the cognitive therapy structure, the thought records, the ability to work with thoughts and recognize them. And that was really important for when people were depressed and struggling with all kinds of very negative, judgmental, harsh, hopeless kinds of ways of seeing themselves in their environment. When people recovered from depression and they got better, and many people did, either with cognitive therapy or an antidepressant, they still had a problem. And that problem was that rates of relapse were high. People would recover, people would have a period of staying well, people would fall ill again. And so I received some money from the MacArthur Foundation to develop a version of cognitive therapy that could be given to people, let's say, less intensively, maybe once a month instead of once a week. Maybe emphasizing factors related more to prevention rather than to acute treatment. And in developing and designing that program, I met with some colleagues of mine from the UK, Mark Williams and John Teasdale, and we decided that an effective prevention strategy or a strategy for people who had residual depressive symptoms would be to help them to develop this different type of relationship to their thinking, to their thoughts, especially when they experienced periods of sadness.
So can you just explain what that means? What is the typical you're talking about a different type of relationship with our thinking. What is the typical relationship that one has with one's thinking?
Well, if you look at a lot of the experimental psychology research, there's something called mood state dependent memory. People in certain mood states are better able to recall information that was encoded during that mood state. And so if you're sad and you have a view of yourself as weak, ineffective, hopeless, and you're no longer feeling sad, it might be that those views are a little bit more distant. But when you start to feel slightly sad, you can tumble back into those ways of seeing yourself. It can re-trigger those schemas very easily. And the people for whom that re-triggering occurs can quickly fall back into ways of seeing themselves, as if they are getting depressed again. And we wanted to find a way to disrupt that, to let people feel sad, because none of us can escape or avoid that, but to redirect the types of thinking or the types of relationships they have with that kind of depressive content, those negative thinking styles that come to mind. And so this is, I guess, a long way of saying that we felt that mindfulness, meditation, actually trained people directly to develop this relationship to their thoughts and to their sensations and to feelings that could allow them to watch and observe these experiences without becoming caught up in the content of what they were thinking or saying to themselves.
Hmm. Okay, so I want to make believe for a couple of minutes that I don't know anything about mindfulness, because I
Right.
think for those on here who've never experienced it before, hopefully in a few minutes we'll have an actual mindful, you'll walk us through an actual mindfulness experience, so those of us who've never experienced it can.
Sure.
But I'm going to try to ask some questions, about mindfulness, as if I didn't understand what it meant, because again, it can sound like an abstract concept until we really break it down and it makes some more sense. But before that, I just wanted to make a couple of announcements, just some housekeeping things. First of all, for those of you who are on, who can turn on your videos, we really appreciate seeing people's faces and their feedback. So if you can, please turn on your video. Let's make it more personal. Thank you, Aaron. Thank you, Shashi. Number two is for those of you who have questions, please ask. Just use the reactions tab on the bottom right of your screen. I see that people are still signing in. We may have to make this announcement again later. Use the reactions tab, raise your hand, and we'll call on you. I also did want to mention that this week's show is sponsored by okclarity.com. For those of you who are clinicians here and have not seen okclarity.com, I highly encourage you to take a look at it, and you might want to consider becoming a member and signing up for their program. It's a great way to promote yourself and get the word out there what it is that you do as a clinical social worker or a psychologist or whatever other wellness field you're in. It's a great marketing tool for yourself. So you might want to take a look at okclarity.com and see, I have a profile up there. You can check it out. You can look at other people's that are up there. I think there might be some people on who have as well. So great. Okay. So let's jump into now this idea of seeing your thoughts as an outsider, watching and observing your thoughts. Why would I want to observe and watch my thoughts if I'm thinking them? Why would I want to kind of step away from them? What would be the value of that?
I don't want to lose the other question you asked, which was what is mindfulness? So let's make sure we get
Okay.
to that too. But
Okay.
basically the ability, and this is something all psychotherapies do. This isn't unique to mindfulness. When psychotherapy works well, we develop the capacity for psychological distance from our internal experiences. We can watch these experiences unfold, but we have a measure of distance which also provides us a measure of choice. So anger boils up in us. And if we can label that and see it, we can feel it in the body and recognize its presence, we don't have to be pulled into automatic reflexive reactions that have been the way that we've expressed or responded to anger in the past. Mindfulness expands your attentional field and allows you to see these things and label them and recognize that they're there and become friends with them, or at least to acquaint yourself with them in some way. That's a different relationship from the more automatic patterns that have pre-existed around difficult emotions, maladaptive behaviors, etc.
So, okay. So, and how does it enable us to step away from those maladaptive behaviors just because we're being mindful and paying attention to what it is that we're thinking?
So when I talk to patients about mindfulness, I don't really jump in with mindfulness per se and a lot of the baggage or the hope and expectations that are found in sort of contemporary society around mindfulness. I try to tie it very closely to the concept of attention. Mindfulness is a kind of training of your attention. And when we talk about attention, it's something that is a wide open door for anyone to come through, to walk through. We already know how to pay attention. You don't have to sit in a funny posture to pay attention. You don't have to listen to bells. You don't have to wear funny clothing. And we already know how to pay attention, but it's a specific way of paying attention. It's a way of recognizing that where we pay attention is sort of under our control. If our minds are wandering, we can bring attention into a certain place. That place is the present moment. And when we bring our attention into the present moment, we also endeavor not to judge what we find in the present moment. So we're with our experiences as they're occurring. We're not judging. Instead, we're replacing judgment with a measure of curiosity and with a measure of observation. That's already a different relationship to a tendency to want to react, to lash out, to feel hurt. And then we can recognize that these states are present and choose, is there another way to deal with this? Is there something here which may change on its own if I just let it be? Is there a way of being kind to myself, taking care of myself, what I need, maybe what someone else needs? It's a different kind of conversation, but it takes a lot of practice. It's not a miracle.
Okay.
And it takes work.
So let me, I think there's two things that I'm hearing you say, and I just want to make sure that I'm getting this right.
Mm.
The first thing that I heard you say is that essentially when we're doing all forms of therapy, on some level, what we're looking to do is create a stronger mindfulness of what it is that the client is experiencing. So if we're doing psychoanalytic therapy or psychodynamic therapy, we're bringing awareness, or what's called another term for mindfulness, we're bringing awareness to what they are experiencing internally, to perhaps why they've been experiencing this for so many years, to how they're reacting and behaving towards things. And I think what you're saying, secondly, is that once we bring that awareness, they then have a stronger ability to choose whether they want to continue. Right? The example, the metaphor I give is, if I'm walking down the street and I'm looking far ahead in the distance and there's a crack in the sidewalk and I continue to walk, I may trip over that crack. But if I'm somewhat mindful to the crack in the corner, even if then I'm looking or I'm talking on both phones or something like that, but because I'm mindful of the crack, I don't have to pay all that much attention to not trip on the crack. I'm going to step over it automatically just by sheer mindfulness of what's happening around me. So in the process of psychotherapy, we're helping people to become more mindful. They then have more of a choice to decide how they want to react to things.
Yeah, I mean, the concept of awareness is found in all therapies. It just has a different term. Observing ego, decentering, non-identification, diffusion. These are the same concepts with different languaging to fit in with a theoretical framework.
Mm-hmm.
I would say that in psychodynamic psychoanalytic therapies, the questions of why and the harnessing of awareness to answer those questions is one of the primary tasks. I think in mindfulness, there's a little bit of a detour from that, which is away from questions of why and into questions of how. How does this anger feel in your body when it arises? Where do you notice it? And what happens in the next moment? And what happens in the next moment? And does it get stronger? And does it get weaker? And is it intermittent? And is it continuous? And then you continue to do this and you get to know your anger. Eventually you can say to yourself, oh, anger is here.
Mm-hmm.
Oh, envy is here.
So the curiosity and the interest of how I am feeling or what I am experiencing, and then just presence with that. Can we talk about
presence and labeling? And can I just say one thing too? When we practice mindfulness, we don't start with very difficult emotions. That's like jumping into the deep end of the swimming pool. The first mindfulness practices we do involve taking 5 minutes to eat a raisin, slowing down the process with a very tangible object that can be that can hold our attention, and noticing that even the automatic activity of eating, chewing, of swallowing, of smelling has a little bit more to reveal to us when we pay attention to it. And so then we're starting to show people there is some value in paying attention in noticing new things. And eventually we'll graduate to things like emotions and other forms of more difficult psychological experiences. So it's all of this training ground to help people to develop this attentional competence, which then leads to an awareness.
Mhm. That's such a, I'm so glad you brought that up because, so many people have this question of what do I do with a client who struggles to identify any emotions? You know, I don't feel anything. Maybe some will say I feel something for others, but not for myself. Very unaware and unpresent with their feelings and emotions. How would we use a mindfulness exercise? Would you say using a more physiological kind of mindfulness based work, would that be a good start to bringing them closer to experiencing their feelings?
One of the strategies in mindfulness is to move into bodily sensations as the place where emotions reveal themselves. So instead of talking about emotions at a conceptual level, feeling, not feeling, feeling too much, feeling too little, we try to first help people recognize emotions in the body and track them as if they were a continuous sort of output that they can once again become curious about.
Mhm.
And then there may be things that people are starting to recognize when they feel a tightness in their chest. There may be an emotion that also comes to mind. There may be an image, there may be a feeling that comes to, there may be a thought that comes to mind. So from the raisin exercise, we do the same thing with the body. We pay attention to different parts of the body, and some parts might be not a lot going on, might be numb, might be kind of tingling. Other parts might be a little bit more tensed and braced. And we're just looking at how that feels, establishing attention, observing, and moving around the body. So we're training people to look when they feel emotionally caught. The first place they should look is in their bodies and not in their minds, not in their ideas about what they should feel or not
Mhm.
feel.
Mhm. And can you talk to the judgment piece? One of the things that mindfulness is doing is it's looking to eliminate judgment. Can you talk to that?
You know, it's interesting when you have someone who has chronic pain, for example. There's often a way in which the idea of what they can and can't do gets like solidified, and they become very much bound up by that. They can't move, or they have to stop moving, or um, it's because of this, it's because of that. And so one of the things you might invite them to do in measured ways so that they don't get overwhelmed, but if they're willing to actually start paying attention to that part of the body where they have these intense sensations and just noticing what their sensations are doing. Are they moving? Are they staying static? Are they increasing in intensity? Are the sensations burning, biting, tensing, bracing, hot, cold? And what happens is by noticing the qualities of these sensations, one moment to the next moment to the next moment, because you're always trying to get people to stay in present moment awareness, they start to have a different version of what their pain or discomfort means to them compared to what their mind is telling them. And so you have this discrepancy between the mind's readout versus what's actually happening in the present moment. And that discrepancy can be very eye-opening for people. And it can also be a place where some of their judgment can fall away because they thought they saw things one way, but their present moment experience tells them that it's a little bit different. Sometimes that creates an opening, and that can help to reduce some of the judgment.
Okay. Just a reminder, if anybody has any questions, please use the reactions tab on the bottom right of the screen and raise your hand and we'll take them. Zindel, I watched your TED Talk, which is a pretty big deal to be on TED Talk. I think I would probably have a heart attack if I had to get up there on a TED stage and speak. But of course, now I would use my mindfulness skills and probably just ace it. But one of the things that comes up with mindfulness is this idea that somehow mindfulness can solve issues such as depression, ADHD, anxiety. Can you talk a little bit about the studies, and can you also explain how it is that something like classical therapies or cognitive behavioral therapy has shown degrees of relapse, whereas with mindfulness, there's some kind of stronger cure. Explain that.
Well, I have to say, actually, the only study that compared cognitive therapy and mindfulness-based cognitive therapy found there was no difference in prevention of relapse. Both did really well. They both did really well. And for people who have been through mindfulness, a lot of them are people who have been interested in coming off medication, antidepressant medication, for a number of different reasons. And the data from mindfulness-based cognitive therapy is showing that people can be protected pretty much on par if you need to come off an antidepressant. That doesn't mean that people should go into mindfulness-based cognitive therapy in order to come off an antidepressant, because some people have different histories of treatment and different histories of recurrent depressive episodes. But if for some reason they need to come off, if they're pregnant, if they have unbearable side effects, if the drug itself is starting to wane in its efficacy, then there is this other approach. And I think that part of what helps is that the mindfulness treatments themselves are multimodal. It's not just meditate for 30 minutes a day and you'll be fine. It's that mindfulness meditation, as I said, helps to directly increase awareness, as you might find in other therapies, which then give people some choices of seeing, if they're feeling well, but they're starting to say no to social plans, if they're sleeping in more, if they're getting very irritable with their children. Maybe they can have the awareness that these are warning signs of a new episode of depression and start doing something for themselves sooner. So there's a mix, really, of the mindfulness meditation piece and then some of the cognitive structured approaches to help people look after themselves and take action. Mindfulness in itself is not a magical pill for people, but it can help them see things coming at them sooner. And as we know, before these processes can build up a biological kind of head of steam, if we intervene, we can have more impact.
So I guess one of the questions that I'm wondering is, if one trains oneself in mindfulness, so suppose I meditate for 20 minutes a day or whatnot. And, is it that it kind of becomes second nature for me to begin relating to my thoughts and feelings completely differently? Or is it that when I begin to have these kinds of thoughts and feelings, I could pull out my mindfulness tool and say, oh, wait, I know what I could do. I could just be mindful of what's going on. Or is it more that there's like an organic transition immediately? As soon as I start having thoughts and feelings, I just relate to them mindfully once I train myself. Or is that too complicated to answer?
I mean, you'll still have the same thoughts and feelings. It doesn't whitewash thoughts and feelings. You still have the same urges, you still have the same desires, you still have the same struggles. But what'll happen is that you'll have a little bit more of an ability to notice that they're coming into your mind, and a little bit more time to choose what you want to do about them. Do you want to just roll with it and kind of do what you've always done? Or do you want to see, is there something else you can do that may be a little bit more of taking care of yourself, looking after other people? It buys you a little bit of time in a way that someone who's had therapy and can recognize competition or rivalry and can understand that that's coming up for them because of a narrative of how they may have been raised, can say that to themselves as a way of stopping themselves and then choosing a course of action that might be more adaptive.
Okay. So, Zindel, you promised us, maybe it was before the show, that we would, for those of us who've never done this before, I would love it if you can walk us through an actual, maybe 5 or so minute mindfulness exercise so we can really have the full experience. If you have something that's maybe 5 to 10 minutes or something like that, or even if it's shorter, but will really touch, hit us. I think that for those of you who've never experienced it, this is a great first time. I would like to say publicly that the first time I experienced mindfulness was about 10 years ago. I was listening to some introduction to, I think it was internal family systems, and the instructor decided to start us off with a, I would say, 10-minute mindfulness exercise. I had never heard of mindfulness before at that point, and I just went along with what he was doing. I could say that it was the first time that I ever felt so deeply calm and present with myself. It was a truly remarkable experience, really, that I so intrigued by it that I've been using it ever since. So if you've never experienced it before, please indulge yourself, and if you have, indulge yourself anyway.
So Moishe has really set the bar very high. And I'd be curious to hear about people's experiences afterwards. It may be that you find that you have the kind of positive experience that Moishe described, but it might be that you find that you struggle and it's not that pleasant. And all of these experiences are totally valid. We'll talk a little bit about what we're doing, but let's just jump into it now without a lot of preamble. The first thing that we do when we practice mindfulness is that we actually pay attention to our bodies and help us settle into a way of sitting that feels comfortable, that feels supported. So the mental attitude is that we want to be alert and we want to be awake during the next 5 or so minutes. So there's a way of positioning the body that lets you leverage that, and if you're sitting slouched in your chair with your hands behind your head like this and your back, those kinds of postures are good for relaxation, but they're not really optimized for alertness and wakefulness. So what you'd like to do is sit on your chair in a way that gives you, or your couch, or wherever you find yourself, just sitting in a way that gives you a good firm base. And the base just means maybe you can feel your feet pressing into the floor or whatever you're sitting on. And then you let your spine and neck and head just rise up in a straight line. And this also opens up your breath way so that you can feel the air coming in and out of your body. If you feel comfortable going ahead and closing your eyes, you don't have to. If you prefer, you can keep your eyes open and maybe just finding a soft gaze on a point 4 or 5 feet in front of you, and just holding on to that. Your hands could be folded on your lap or on your thighs, and beginning by just paying attention to the sensations of sitting. The pressure in the soles of the feet, points of contact, the buttocks on the chair, couch, whatever you're sitting on. The spine rising up from the pelvis with the neck and head balanced. Just sitting. And now in the first step of the 3-minute breathing space, perhaps shifting your attention, looking into the mind, asking yourself, what is my experience right now? What thoughts are here? What feelings are present? What bodily sensations are making themselves known? And as best you can, just allowing all of these elements to simply be here, watching, observing them from one moment to the next. And now seeing if you can let go of the contents of mind, bringing your attention to a single pointed focus on the breath at the belly. And seeing if you can feel the movement of the air as you breathe in the belly rising, expanding. And as you breathe out, belly falling. And just giving the mind this one thing to do, as best you can, staying with this gentle rhythm of rising and falling, breathing in and breathing out, moment to moment, and breath by breath. And now seeing if you can expand your attention around the belly and around the breath, allowing your attention to radiate outwards from the belly into the whole body, and feeling the whole body sitting, and feeling the whole body breathing, from the crown of your head to the soles of your feet. One whole breath, one whole body. And then when you're ready, just allowing your eyes to open and returning your attention back to the room and back to the screen.
Shoots, I hate coming back.
You notice that transition.
Yeah. I noticed myself wanting to stay there.
So if anyone's interested in just sharing what they noticed in each of the 3 steps or how this was for them, Rivka says it's so beautiful.
Okay, let's start with Shashi and then maybe Rivka. Rivka, would you speak next, please?
All right.
Kanalea, anybody? Okay, Shashi, go ahead.
Yes, hi. Thank you so much. Thank you. Thank you to you, Doctor, and thank you, Moishi, for bringing him to us. So I'm not new to meditation. I actually like mindfulness and I really love it and appreciate it. However, I do become very aware of my tinnitus when I'm right. And I don't like that because otherwise I never feel that it exists. But as soon as I start really quieting and turning in, that's the first thing I notice. And first of all, I wonder how it is even medically, because from what I know about tinnitus, it's always better to ignore it and just like not pay attention to it. So I'm wondering if someone like me, or if I would ever have a client like that, if maybe sometimes mindfulness is not a good thing. And second of all, can it actually maybe help with tinnitus? Can mindfulness actually help?
Yeah.
So that is my question.
Yeah, thank you. It's a hard question to answer because I think the invitation in the practice of mindfulness is to try to develop a different relationship to the tinnitus. If people feel most comfortable when they're not aware of it, then sometimes bringing attention to it can, be unpleasant. But if there's a way of living one's life with creating room for it alongside the things that people want to do in their lives and using mindfulness to make some of those choices, those are some of the aspects of programs that I've seen where mindfulness meditation is used with people that do have tinnitus.
Okay, thank you
You're welcome.
very much. It was a very, very nice experience. Thank you.
You're welcome. Thank you.
Can somebody else share their experience, especially somebody who's never done this before? If you had the experience for the first time, we'd love for you to raise your hand. Or if you can't figure out how to raise your hand, to unmute. Anybody share what their experience doing this mindfulness exercise was like? Okay, we'll give you a few minutes to think about it, but please share. We want to hear some feedback. I have a question for you.
Yep.
I'm panicking and I'm losing my breath and my heart's beating and there's a reason. It's a silly reason. It's social. I'm in a crowd of people and I really want to make friends or ask somebody out or whatever. But I'm panicking. I'm terrified. Is mindfulness something that I can tune into in the moment, calm myself down with, or is this something that needs to be done not in the moment?
I think of it as a sequence of steps. Mindfulness, if your body is already hyperactivated and you're at a point of very high arousal, then mindfulness is probably not going to be the only thing that you need to do. Mindfulness can help with a kind of grounding, a kind of settling into present moment through either the generation of sensations or a focus on sensations. But if things have sort of taken off and you're way past that in terms of your arousal, you may need to do something more structured to deal with that.
Because I feel like that myth needs to be dispelled, where people think that if once they learn mindfulness, then it has to help them when they're feeling anxious. And they have to be able to mindfulness is supposed to help, as opposed to it kind of being a way of living.
Yeah, no, I mean, that's the whole problem with seeing it as a panacea. Mindfulness really is helpful alongside other things that are helpful. And it can often be the first thing to help you make a choice. But, even the way that I led this practice, when you go online on YouTube, there's a lot of mindfulness out there. Type 3-minute breathing space, and you'll find lots of people happy to guide you in the 3-minute breathing space. But you know what you're also going to find? You're going to find people who are happy to guide you in the 3-minute breathing space while there's really nice music going on in the background, or while there's nice light blue light that makes a nice, comfortable physical image, a visual image. And there may be a voice that becomes very soft and dreamy. And all of these ways of understanding mindfulness have a meta communication to them, which is you should be relaxing. You should be in a state of complete letting go. And that's really not the point of mindfulness. Yes, it's true when you close your eyes. Yes, it's true when you sit in a chair. Yes, it's true that when you only have one thing to do, your body naturally slows down. Your autonomic system slows down, just closing your eyes and doing things like that. But the point of mindfulness is actually about investigation. It's not about achieving relaxation or emptying your mind, but those are the popular stereotypes that are out there. And even here, when I was guiding the 3-minute breathing space, it was look in your mind and notice what's present, what thoughts are here, what sensations are present, what bodily sensations are making themselves known, what emotions are here. It wasn't guiding to feeling relaxed or feeling good. If one of those emotions that you had was worry, say that, name that to yourself, that's fine. So I think that that's one of the areas where there is a bit of a mismatch, and why people feel that if they're going to do mindfulness and it's going to quote work for them unquote, then they should be relaxed and able to just fall into a state of relaxation. It's really not what it's about.
Right, right. And I think that one of the ideas behind mindfulness is for people to um let's see if I can explain this, for people to step away from the self-loathing, if I can use that word, self-judgment, self-loathing that comes along with I am so anxious now. I'm so anxious now. I'm panicking now. And what's wrong with me? I ought not be panicking. This is a simple thing that everybody can do. What am I still worried about? So there's a lot of judgment and a negative narrative people
Mhm.
begin to develop about themselves. And when we use mindfulness, what that essentially means is we're just curious about what it is that's happening. We're not judging or despising ourselves, but we just want to understand, wow, that's a pretty strong reaction. What does that feel like? And I wonder why that's happening. And one might go as far back as to say, I wonder why I have this to begin with. Why
Mhm.
are public places so scary for me? What
Mhm.
happened in my past that may have been cause of this? And what does it feel like? And
Yeah.
to just almost be curious as if it were another person who came into the room who you wouldn't judge, you just wonder about.
Take the next step. Befriend it. Oh, here you are again. Oh, here I am trying to meet someone for the first time. Oh, here you are again telling me that this is going to go nowhere.
Mhm.
Oh, here, let's make some room for you to sit down next to me. So here we both are. There's a wonderful line in a poem by Billy Collins called Insomnia. Billy Collins was the poet laureate of the US. And he writes about he writes this poem called Insomnia, where he talks about his relationship to insomnia. And he describes it, and he says at one point, my own worst enemy, my oldest friend. So he's not pushing it away.
Mhm.
He's saying, here I am lying down in this dark room, and I'm tossing and turning, and my mind can't shut off. Oh, here you are again.
Mhm.
And so he's trying to develop a relationship to it in that way. Now, it's not easy, and most of us, if we have something that hurts us or that is difficult, we want to push it, we want to get rid of it. We're often promised drugs or therapies that can miraculously make stuff go away.
Mhm.
If it does, that's great. But there may be some things that you do want to have a sense of acquaintanceship with, so that if it arises, it doesn't completely take away your right to exist. And so mindfulness can help create a little bit of that attentional field where you see it and, oh, so you're here, or welcome, or, thank you. I don't need your advice today. Thank you. I don't need your protection today.
Right.
That's a kind of narrative that you can have with it that separates it from you.
Mhm.
And sometimes that can be helpful.
And what about inviting it to come? See, what if I knew that every time I was in a public place, I get panicky and I get this anxiety? What if before I went into the public place, I would say, hey friend, would you join me and panic me in the public place like you always do? I mean, you're my comfort, you're my friend in public places.
I don't know. I don't know. Like you'd have to play around with it. It would be an attitude of curiosity. Um, I've heard people say that, for them, when these things show up, when these narratives show up, they acknowledge, oh, you're here, but I don't really need your protection right now. Thank you.
Mhm.
Um, so that you're trying to negotiate some
Negotiate,
kind of
right, right,
relationship with
right. And again, that would be similar to the mindfulness experience that we have through classical therapy, where it's like,
it. Yeah.
now I know why you're here. I know
Yeah.
you're my dad's voice,
Hmm.
in my mind. I know you're my, the principal's voice criticizing me or punishing me. And I don't need you here now. It's not the same. It's not what's happening. It's not the reality.
Yeah. So you're starting to disidentify with a part of yourself that you thought was inherently you, and able to externalize it to some extent,
Right.
concretize it, and then have it maybe have less of a direct control over your emotional life. Give yourself a little bit more of a chance to express things that you want.
Right. Okay. I know there's somebody here with a question. If you don't mind raising your hand, that would be great. But let's move on to the next part of this discussion, which is
So Rivka has a
yeah,
question in the
Rivka.
chat. Can I address that?
Sure. Rivka, could you turn on your mic? Would you unmute or okay, go ahead.
So she writes, how do we differentiate when mindfulness is still containing, when the emotion is too big and needs more intervention to manage. This is really important. And the way that we work with this is very similar to the way that we work with pain or intense feelings in the body. There's a kind of way in which when we invite people to explore parts of their body in which they feel intense sensations, part of that invitation is to take your attention right into that part of the body. It might be an ankle, it might be a knee, it might be a lower back, and to explore the sensations that are there. In other words, observe them from one moment to the next, notice their qualities, maybe even make a note of what those qualities are. Now, it's possible people are attending there, they may get overwhelmed. They may notice a sensation and an emotion may come up, or a thought may come up, or a memory might come up. If people get overwhelmed, we suggest that they take their attention back to the breath, back to a place of anchoring them in a more neutral location, breathing in, breathing out, feeling the belly rise or the nostrils or the chest lifting and falling. So there's this back and forth between a place of relative centering and venturing out to explore and investigate areas of difficulty. And I think we try to do the same thing with emotions. When people can feel overwhelmed, we have them back off. And they're the ones that are titrating how much time they spend dealing with a traumatic memory or a hurtful comment or something that they did, which was like a disaster or a failure. How much of that they're willing to explore mindfully, to observe and be curious. And if they get overwhelmed, know that there's also an anchor that they can return to. And it's that oscillation back and forth. That's, I think, one way of answering your question, Rivka, about containment versus returning to safety and having both of those as options.
Yeah, thank you. Thank you. I'm just wondering, sometimes as a therapist, to notice with the clients when they're like so hyper-focused in the mindfulness, and sometimes it's not so helpful when you can't manage it.
So who's hyper-focused? The patient is
The
hyper-focused?
patient, yeah, the client.
Yeah, and so that the client is hyper-focused on mindfulness, one of
And
my,
wants to continue being in the mindfulness. And when do I know when it's
what do you mean by being in the mindfulness? They want to continue practicing with you?
practicing? Yeah.
Well, I think it's interesting in if you're using mindfulness in the context of therapy, there are natural limits that we're all working under. There's a certain amount of time, and as a therapist who's having to manage that time, I think there are ways in which you want to leave enough time.
Right. I'm not referring to the time. I'm referring to when the emotion is too vague or when the pain is too vague. To just, okay, I understand your answer, to titrate and to come back. I appreciate it. Yeah. Okay.
Yeah. Right.
Thank you.
Yeah, you're very welcome. So now there's a question from Ellen. Where do you draw the line between curiosity, being curious about your experience, and too much analysis? So Ellen, this is really like the heart of the matter right here. When I talk about curiosity, I'm not interested in content. I'm using curiosity to step outside of content. Curiosity for me is like naming a sensation as burning or itching or cold or numb or hot. And my curiosity is what comes next. I think analysis is much more around why is it cold and why is it not hot? Why is it numb and why is it not tingling? And why do I feel this way? The curiosity is intended to be an antidote to analysis, but it's very hard for us to step outside of analysis because in many ways, that's all we really know how to do.
So if we're trying to compare it to, an older experience that we've had, like something is triggering us from the past, we're not trying to get into that at all. We're just trying to notice that, this voice is reminding me of my principal or, something like that. And we're not actually trying to go back into the feelings of it and how it reminds us of, those feelings.
So that's a great example. So we're following a sensation, let's say, and now it's burning, and it's still burning, and now I'm reminded of a situation with the principle. So I would say to myself, sensation, burning, thought. What happens next? Sensation, burning, oh, another thought. Sensation, oh, now an emotion. Now another sensation. So it's like a continuous observation of where the mind goes. The mind is following a sensation, another sensation, oh, now there's an emotion. But I don't get into that emotion and say, this is why I have the sensation. It's more like an ongoing train, and I'm just noticing the things that are showing up. And there is time.
And if
Sorry, I was just going to say, there is a time for analysis, obviously, but I think when we're practicing mindfulness in this way, we're just trying to describe and to be curious and to be kind to what we find.
and if our mind does go to that, analysis, to that place, would you say being mindful of that would be part of that same process? I'm noticing that we're going there.
Yeah. As long as you as the therapist are the one who can say, okay, no, we've noticed some very interesting things. Now let's put our therapy hat on and see if this makes sense to you, given what we know about your history or given what we know about what you've talked about.
Okay, thank you.
You're welcome.
So Zindel, one of the things that we were supposed to talk about was mindfulness-based cognitive therapy. Where does the cognitive therapy come into this whole mindfulness-based work?
So I think it comes from what I said at the beginning, that there is a way in which cognitive therapy, through thought records and through getting people to see their thoughts as automatic interpretations or ideas about themselves, hypotheses, if you will, not facts, is the same place that mindfulness meditation can get you to. I believe mindfulness meditation gets you there more directly and more efficiently. But the idea of seeing your thoughts as not being facts is a big part of cognitive therapy. So we use some of these cognitive therapy principles to help people see that thoughts aren't facts. We also use cognitive therapy principles later on in our program to help people prepare relapse prevention plans, to notice their activity levels, to notice the correlation between activity and moods, to develop a list of nourishing and depleting events, to look at mastery and pleasure events. These are kind of the standard things that you find in cognitive therapy, but we do them through a mindfulness lens of helping.
So if I understand what you're saying, when we do cognitive therapy, it seems like it's a more active process on the cognition. So it's like we're evaluating. I think you're not allowed to say, God forbid, challenging your thoughts in cognitive therapy. You have to say evaluating or something, right?
Gathering
So we're
evidence. That's
gathering evidence, evaluating our thoughts, and then questioning, whether we have to have those thoughts.
Yeah.
We're not challenging them,
Right.
whether they are rooted in something, in some core belief that's accurate.
Yeah.
And when we're using mindfulness-based work, we're not seeking to pay attention as much to the content of the cognition,
Right.
as much as being curious what the cognition might be, what it perhaps it leads to, what feelings it leads to, what emotions it leads to,
Sensations
what
in the body,
sensations it leads to.
what emotions, and then also the fact that it's there, and being curious about the fact that it shows up
Mhm.
and what happens next.
Mhm. Mhm.
So you're right, not getting at the content, but just seeing, oh, my mind is filled with thoughts. My mind is racing, and if my mind is racing, maybe I need to do a 3-minute breathing space to ground myself.
Do you see cognitive work as contrary or contradictory to the mindfulness work? Because in the mindfulness work, we're just being present present and curious with the process that's going on. Once we start going into sort of evaluating the thoughts and going into the content, we're actually stepping away from the presence.
Absolutely. Yeah. So the way that I see it is that you need to sequence it. If someone is in an acute episode of depression, I wouldn't use mindfulness with them. They do need something that's more content-based to deal with their thinking and even behavioral activation. As they start to come out of their depression, then I think a mindfulness approach can be helpful because the automatic thoughts may not be as urgent.
Mhm.
In fact, if I was doing anything from the mindfulness toolbox with people that were more depressed, I'd probably start with mindful movement, with yoga, and less with sitting meditation.
Interesting. Okay, let's take a question from Shashi. Go ahead.
So I think you maybe just answered my question. I was going to ask, so how does change happen in mindfulness if it's only about observing? And
Observing, yeah, that's a great question. But remember, observing is not just for the sake of observing. It's observing to inform a choice that may not have been present if the only reactions available were automatic reflexive ones, patterned on past history. You're helping people make choices for themselves that they may not have seen as being available to them beforehand.
yeah, I understand what you're saying. I'm just wondering how it, in long term, how much of effect, like I'm not questioning how much, but I'm wondering how. It actually, I'm like thinking of specific clients. So first of all, I understand that you're saying if somebody is actually in an acute depression,
Yeah.
that's not right. So that makes sense to me.
Yeah.
But I'm thinking even dysregulated emotion, like people are like DID, what we call it, like how do they actually choose to make different choices or be less reactive?
Well, one example might be people who are abusing substances. And so for them, what happens is that they start to recognize that their behaviors are often precipitated by urges. And some of those urges are connected to negative affect. So they get to know their urges very well. Just like Moshe said, the panic disorder, you start to get to know the fear and those kinds of intense bodily sensations very well. They get to notice their urges, they get to notice the negative affect that may be there. And so when those urges come up, they can start to name them, and they can start to have a relationship to the urges that may sometimes allow them to postpone acting on using substances or do something else or call a friend. I mean, if you look at dialectical behavior therapy, they have a lot of things that they recommend people do as a way of generating alternative sensations, alternative ways of responding to these urges, either to self-harm or to abuse substances. And the more people practice mindfulness, the better they are at being able to use this attentional muscle to study, their emotional reactions and make different choices. And over time, those things add up.
I have a bit of a conceptualization here that this is how I picture it. And Zindel, I'd love to hear if you agree with this. I think that if a person practices mindfulness, they develop new neural pathways. Okay, and which means that in effect, what starts to happen is when they begin to experience a striking emotion, a change of affect, because they've been programmed and conditioned to become curious about that, rather than to go into this neurotic conflict. Help! I'm having this condition. I'm having this affect, and I don't like how it feels, and I got to get rid of it. Right? They begin to develop, just go into automatically fall into an observing ego. So that in and of itself, it has a certain calming effect because it precludes them or protects them from that neurotic conflict that they go into, that sometimes spirals and twists and goes into this downward spiral.
Mm-hmm.
Okay, Shashi, if this makes sense to you. So I'm just imagining I become anxious about something, and now I sort of fall right into my pattern of, hold on a minute, what's going on for me right now? Okay, whoa, that's a strong feeling. Okay, strong feeling, but that's okay, I can have it. And so right there, if that becomes something that I am completely accustomed to and conditioned to, it should help my general sense of anxiety, the anxiety that builds upon that anxiety, the shame that builds upon that anxiety. Zindel, what do you say?
I think that's spot on.
And thereby, a person can start choosing different things in, like, actually, let's say, managing the house, or just doing chores, or, like, I'm thinking of a specific client that I'm wondering if I can even take her back to just the original noticing and start over there.
Mhm.
But then I'm thinking, like, she lives in such a chaotic world within herself, external and inside, without any insight of what she's attributing to her life.
Mhm.
So I'm wondering, like, how will eventually she, through mindfulness, she will be able to start actually functioning.
Don't, you're talking about climbing a very, very tall mountain. Start at the bottom, start with the breath, start with a raisin, start with attention, start with something that you understand. Not at the top of the mountain, just start with the breath. And even in sessions with you, start with the breath before you even get into the therapy. I'll often start my sessions with a 3-minute breathing space. And then we're kind of both at the same level, and then we can start talking about things. Um, your ability to regulate yourself through some of these practices can also be a way of
Right,
being available to her when you find that she starts to get carried away.
right. That's what I usually do. Right.
Yeah, yeah,
But no, but I like that you told me I'm climbing too big of a mountain. Let me just start. Yeah,
yeah.
not
Start at
that
the
I
base
still
camp.
want to see her functioning and want to see her kids being taken care of. But you're right. It's not where I'm at with her. Far from it. Yeah. Okay.
And,
Thank
and, and this is this is a form of regulation. If she's able to regulate a little bit at a time, then and when small things in her life change her affect, she's able to notice that, then hopefully, her peaks won't be that high. When she starts to feel somewhat dysregulated, she'll just again be conditioned to notice that and notice that and notice that.
I mean, the last thing I'll say is the value of the breath is that it's always with her. She doesn't
you. I'm
have to
sorry,
be
I
with
didn't hear
you.
that. What'd you say?
The value of focusing on the breath is that it's always with her. Wherever she is, she can always drop in and feel her breathing. She doesn't have to be with you, and she can do it anytime during the day. It's very portable. It's very effective that way. So it can be something that she carries with her as just a building block.
Yeah.
This is great. Any final questions? Does anybody want to share a comment or a question about the mindfulness exercise? Any other questions about mindfulness or mindfulness-based cognitive therapy from its founder?
I have a question, another question.
Go ahead, Alan.
When it comes to grief and loss, before someone, is in a really depressive episode and they're just trying to process something like that, could you talk a little bit about how mindfulness could help in that process and, how they even process that information?
Um, one of the principles inside mindfulness is that we are training ourselves to allow and to approach experiences, positive, negative, or neutral. So allowing and approaching in the context of grief, trauma, are very important skills to have, because I think if the natural tendency is to want to block off, want to reduce or diminish, then this can be a way of allowing people to, more naturally understand or experience emotions that over time can be very healing. And at the same time, this balance that we talked about with respect to not being overwhelmed, having a place of grounding, a place of anchoring themselves as they feel a swell of emotion or recognition of loss or things like that. The stability offered by the practice of mindfulness can sometimes provide some comfort for people.
Okay.
Okay, well, thank you for that question. Dr. Zindel Segal, I want to thank you for coming on tonight and sharing this sort of introduction, a little taste of mindfulness-based cognitive therapy. Don't forget to check out the book, The Mindful Way Through Depression. Share it with your clients, read it for yourselves. Check out the TED Talk from Zindel Segal and other things on YouTube. Any trainings or workshops that you want to share with us?
Not really.
Okay. Okay.
Yeah.
So
There's a
again,
lot of stuff out there, but thank you for inviting me and for allowing me to meet your community and just having a very nice casual talk about some of the favorite things that I like to do.
yes. Well, thank you for giving your time to the mental health community. Again, this is going to be sent out to 1,400 or so mental health professionals. So
Awesome.
widespread. And thanks again for coming on.
Okay, good night, everyone. Take care.
Good night.
Be
Bye-bye.
well.